along with cotton rolls. Am I audible to everybody? Are my slides changing?
Yes, doctor.
Okay. So rubber dam isolation is not mandatory. In case you can't do rubber dam isolation, gingival protection along with petroleum jelly and cheek retractor cotton rolls can also be done. The patient should be given protective eyewear in case the bleaching agent spatters or anything. Next step is to etch the surface with 37% phosphoric acid and wash it. And then apply a wet gauze over the opposite arch to prevent damage from excessive bleaching agent. One of the important roles in tooth bleaching, especially in vital bleaching when the patient is going for all the teeth bleaching, is that not to bleach both the arches, that is the maxilla and the mandible, not to bleach them at the same time. Preferably first to be done on the maxilla so that the mandible acts as a reference. Next is to apply hydrogen peroxide in a wet gauze over the tooth surface. And a light source can be used for activation. And this procedure has to be replenished every 4 to 5 minutes. Then removal of the dam once the tooth has whitened and shades have become lighter. Wash it, wipe it, and apply sodium fluoride gel to prevent sensitivity. And in the end, we can also use pastes and rubber cups to finish and polish the tooth. So this is what is being done commercially for many years. So next are certain commercially available products which have become popular now and which most clinicians I've seen are using it in their practice. So the first is the Opalescence Boost. So let's have a look at the video of how to use Opalescence Boost. So this is how Opalescence Boost comes. It comes in 2 syringes which are attached to each other. Now, once the scaling of the patient is completed, we can see that they're polishing the tooth. So polishing of the tooth will also help in preventing any kind of sensitivity after scaling. Then pre-operative shade selection. In this video, they're saying that A3 is the shade. Now they're applying petroleum jelly onto the lips to protect it. Cotton rolls have also been kept. Now, the next important step in bleaching is that to place a gingival barrier. So most of the bleaching kits will have this gingival barrier along with the bleaching agent, which comes with a syringe and a tip, and the tip can be applied over the marginal gingiva as shown in this video, covering the marginal gingiva and the incisal third of the tooth, so that when you apply the bleaching agent, that doesn't seep into the gingiva and damage the soft tissues. After applying the gingival barrier, it has to be cured, light cured, so that it gets set and it is firm in place. Then suction the excess saliva. Next step is to dispense the liquid and the paste into both the syringes. We have to mix it carefully and take all of the contents into the red syringe. So about 10 to 15 times when you press it on both sides, it gets mixed like how they're showing in this video. Once there is a homogeneous mix, you can take all of the contents into the red syringe. After taking all the contents into the red syringe, they're attaching a dispensing tip, which also comes in the kit. Checking if the material is flowing properly. Now onto the facial surfaces of the teeth. This material is placed like how is shown in the video. And once it's placed, suction has to be kept. Now, each of these materials have a very detailed manufacturer's instructions. So in those instructions, it will be written for how long in every step this bleaching agent has to be placed onto the tooth. For some materials, it is 8 to 10 minutes. So Palisand's boost is also like that. For 8 to 10 minutes, we have to place this onto the tooth surface. After that, with high vacuum suction, we can remove the excess bleaching agent and then check the shade if it's become lighter and show it to the patient also. In case the patient is not happy and wants it to be even more lighter, we can repeat the same process again. So, like I told you in the manufacturer's instructions itself, the time period for how long this bleaching agent should be kept will be mentioned, along with which also how many times can we do it in one appointment is also written. So, for some, it is like 3 times, for some, even 4 times is okay. Once the desired shade is reached, we can remove the gingival barrier, like how with an explorer, how they're showing here, and then clean and pumice the teeth again. They're just protecting the gingival tissues over here. Okay, now we can see that the shade has become much lighter than the preoperative shade. The second material that is commonly used is Pola Office. So Pola Office has these contents in the kit. It has 2 powder pots, 1 gingival barrier, and 2 hydrogen peroxide syringes. Okay, so let's see how to use Pola Office. Sorry about that. Preoperative shade selection is done. Cleaning the teeth with pumice. Placing the gingival barrier. Covering the incisal third of the tooth, also the marginal gingiva. Light cure it so that it gets set and it is firm. Now take the contents of Pola Office. This is the hydrogen peroxide syringe. Attach the tip and dispense the contents of this syringe into the powder pot. So once we're dispensing, we can see that the powder will become blue in color. That is the color of the bleaching agent that has to be applied. Then mix it well to make a homogeneous mixture. Now take this applicator tip and apply it onto the facial and buccal surfaces of the tooth. So for Pola Office, they say up to 4 times in one sitting, we can do bleaching and leave the gel for about 8 minutes. Bleaching light is optional. If you want, you can use it. It will only accelerate, but sometimes it produces heat. Then after removing the excess bleaching agent, we have to wash it with a high vacuum suction. Once the desired shade is reached, remove the gingival barrier slowly with the explorer. Another material is Polar Office Plus. So this doesn't come as a syringe and powder pot. This comes as a single syringe. Now Polar Office can be used for more than one patient, whereas Polar Office Plus can be used only for one patient. And it is also said that once mixed, it should be used within 1 hour, the bleaching material. In case they're using traditional techniques, then we can buy gingival barriers that are available commercially. One such thing that I found on Dental Cart is Waldent's Gum Shield. So these are some cases that I have done a vital bleaching in. This was a young patient in his teenage who's come for an aesthetic treatment. So before the aesthetic treatment, I wanted to do vital bleaching. So preoperative shade is A3.5, as you can see in this picture. And then the gingival barrier was placed, cured, and bleaching agent is applied. I used Polar Office only. And then post-operatively, we can see that the shade has lightened to A1. After a few weeks, the patient went for aesthetic treatment also. Another case done by me where the preoperative shade was C4 and post-operatively it lightened to C2. Another case of vital bleaching where preoperative shade was A3 and postoperatively it was A2. Patient didn't want more of lighter shade, so we stopped at that. This is a picture of how gingival barrier was placed. Another case showing the preoperative and postoperative results of vital tooth bleaching. Next is power bleaching. Now, what is power bleaching? It's just an accelerated way of in-office vital bleaching. So it will speed up the process and help in breaking this peroxide faster and form free radicals that will lighten the teeth color. So what are the things that will help in power bleaching is conventional bleaching light, which are available in the market, LED light emitting diode, argon laser, a xenon plasma arc light, and diode laser light. So again, I found some commercially available products for power bleaching. So this is a chair mount bleaching unit from a company called EndoKing. And then there's Philips Zoom. This is widely used, but it's quite expensive also. And there is one bleaching light which is becoming famous now called Blank One. I've seen big aesthetic dentists using it in India itself. And in case we're using laser, here we're seeing diode laser biolace. So these lasers will come with an option such as tooth whitening. We just have to select that option and place that onto the tooth, place this light onto the tooth after placing the bleaching agent, and that will help in faster bleaching and more effective bleaching. Next is non-thermocatalytic bleaching, where heat source or nothing is used. So one product which is commercially available is Privest Den Pro. It's a pH activated system with 35% hydrogen peroxide formula. It's called the Florence in-office whitening system. So these are all in-office vital bleaching technique. The next type of bleaching is at-home bleaching technique. This is also done for vital tooth. So an at-home bleaching technique, first is the patient has to come to us. So an initial consultation has to be done. Then clinical examination of all the teeth, if there are any cracks or decay, or how are the restorations, how is the gingival health of the patient, all of that has to be examined. Then radiographs also have to be taken. Once everything is okay, plan the treatment, impression taking, and tray fabrication. These are the steps. So where are these indicated is in mild generalized staining, age-related discoloration, mild fluorosis, acquired superficial stain like smoking, tobacco, and all that. Contraindications is when there is not sufficient enamel or there are deep surface cracks, fracture line, inadequate or defective restorations, very young adolescent patients who have a very large pulp chamber, severe fluorosis, non-compliant patients. Non-compliant patients means if you give them the bleaching kit to take home and they don't follow it or they follow it like too much, they use the bleaching agent more than the suggested time. Pregnant lactating ladies also, we contraindicate bleaching. So what are the clinical steps? First is to take impression, then form an impression tray, and then to give the tray. So how should this bleaching tray be? It should be strong, easy to fit, easy to remove. It should be bio-inert and well tolerated. It should not cause any sort of irritation or anything to the patient. It should be smooth and well polished, especially the edges. Fit comfortably but passively, not feel too tight in certain places. So let's have a look of how this procedure is being done. Preoperatively, we saw diagnosis treatment planning done, impression taken after clinical examination radiograph. Tray fabrication is being done here. Once the tray fabrication is done, we have to demonstrate to the patient how to apply this bleaching agent. That is, 2/3 of the tray should be covered, and mostly the bleaching agent should be placed onto the facial surfaces of the teeth. Okay. After which the tray can be washed, and the patient also has to take the post-operative instructions. So before and after few weeks, we can see that the teeth have become lighter in shade. The treatment regimen which we have to tell the patient is brush the teeth prior to tray application, place enough bleaching material, 2/3 is usually what we tell, cover the facial surfaces mostly, seat the tray, and the extra material should be wiped off. While removing the tray, remove from the second molar region, rinse off the bleaching agent, clean the tray, and the duration of treatment usually depends on original discoloration, how bad or how yellowish was the discoloration, patient compliance if they're using it regularly, suppose say every day for 2 weeks, for 4 hours, they have to put it at night. If the patient is following it for 2 hours, or is it only like 4 hours, 2 hours, or 6 hours, depends on the patient compliance. And they have to come in for periodic checkups. Maintenance and additional bleaching might be required in this type of bleaching technique. That is, can be done after every 3 to 4 years if necessary for a duration of 1 week. Some disadvantages are there with this kind of bleaching technique. Mostly is the gingival irritation, soft tissue irritation, altered taste sensation due to the bleaching agent, and tooth sensitivity. So this is the main reason that we always tell the patient to go for in-office vital tooth bleaching, because all of this can be controlled then, except for tooth sensitivity, which also can be controlled to some extent. The next type of bleaching agent is over-the-counter bleaching technique. This is also done in vital tooth. So for this, the patient doesn't have to come to the dentist. They can directly go to the pharmacy and buy any commercially available product and use it. So it is a low-cost alternative and it is done without dentist supervision. It contains very low quality, low level of whitening agent. It is self-applied and there are 2 daily applications for up to 2 weeks. Colgate Visible White, I'm sure all of you must have seen this. And Sensodyne Extra Whitening is also such an agent that is available in the market. Some things that are very unpopular and not used also, but I just wanted to add in the presentation is hydrogen peroxide strips. This is a trayless bleaching system. Comes in a thin strip with a pre-coated adhesive of hydrogen peroxide gel. So this strip will have a backing. The backing has to be peeled off and the strip is placed directly on the facial and the buccal surfaces. Each strip is worn for 30 minutes, removed and discarded twice a day for 14 days. These are the general instructions. And some products that I found are hydrogen peroxide strips, but generally we tell the patients not to use any such things because they can damage the marginal gingiva. So these are all vital bleaching techniques that we saw till now. Next is non-vital bleaching techniques where the tooth is non-vital. So all of non-vital tooth bleaching technique will be done only once the endodontic treatment of the tooth is completed. That is, first step is to do root canal. In non-vital, the first is intracoronal tooth bleaching. So what are the indications for intracoronal tooth bleaching? Is discolorations of pulp chamber origin, moderate to severe tetracycline staining, dentin discoloration. Contraindications are superficial enamel discoloration, presence of caries, and unpredictable prognosis of tooth. These kind of bleaching techniques are contraindicated. Let's look into the clinical steps of the traditionally used method. First is to familiarize the patient. We have to tell them what we're doing, why we're doing this, because if it's a crown, then you have to trim the tooth structure and all that. Especially in front teeth, we have to familiarize the patient. Take radiographs. What are we checking in the radiograph is that how good is the obturation, how good is the apical seal, how is the prognosis of the tooth, is there any sort of resorption or anything. So that is what has to be checked in the radiograph. Next is assess the quality and shade of the restoration. Evaluate the tooth color with a shade guide. Isolate the tooth with rubber dam. Remove all the restorative material from the access cavity. Apply a sufficiently thick layer of at least 2 mm of protective white cement barrier. Then prepare the walking bleach paste. So how walking bleach paste is prepared is that the sodium perborate salt can be mixed with saline or hydrogen peroxide, and then that is taken and placed into the access cavity after the coronal restoration is removed. So that is how walking bleach paste is mixed. Remove the excess bleaching paste and carefully pack the temporary filling for at least 3 mm thick. And remove the rubber dam, recall the patient after 2 weeks and repeat if necessary. So like I told you, first step is to do root canal treatment. So we take a radiograph, then we assess how the root canal obturation is. Then see the apical seal if it's good, coronal seal if it's good, see the periapical changes. Mostly preferably no periapical changes should be there. And then remove 2 mm of the GP below the cemento enamel junction and then place a barrier for 2 to 3 mm. A white protective cement is what they say. So place the barrier. Why is this barrier very, very important? Is because when we place this bleaching agent into the access cavity, this bleaching agent should not seep into the root. It only has to stay in the coronal portion of the tooth, which is why it is very important to place a very strong, good barrier. After placing the bleaching agent, which is dispensed into the access cavity, a temporary filling is placed, which is also about 2 to 3 mm, so that it has a good seal and the bleaching process will continue for about 2 weeks' time. So Palison's Endo, this can be used for multiple patients with one syringe. So this is one commercially available product that we commonly use for intracoronal tooth bleaching. This is a case where we can see the canine is slightly discolored. Now, radiograph, post-obturation radiograph, root canal filling at the level of cemento enamel junction, thick barrier placed, bleaching agent placed into the coronal access cavity, and a temporary restoration is also placed. So let's have a look on how this procedure is done. The original tooth shade is A2, but this tooth has discolored to C4. You can see that they're removing the restoration from the coronal part of the tooth. Now the access cavity is clean. There is no sealer, no GP, no restoration. Opalescence endo is displaced. It's placed into the access cavity as shown in this video, after ensuring that there is a thick barrier at the cemento enamel junction only. Now a small cotton pellet is placed also, so that above that we can put a temporary filling, or even sometimes GIC will also do. Here they're placing GIC. We should ensure both apical seal at the cemento enamel junction, and seal coronally also is very important, so that the bleaching agent is in place. And finishing and polishing.
On this concept, this one can
From A2, it is like this tooth has changed from C4 to A1. This is a picture of a non-vital tooth bleaching that was done by me, the pre-operative picture and the post-operative picture. And in this case, I've used Opalescence endo only. Another case where one pre-operatively and post-operatively non-vital tooth bleaching. So what is thermocatalytic or photo bleaching procedure? It is similar to the same walking bleach or intracoronal tooth bleaching, where activation is done by heat or light source or heated instrument, which is placed in the access cavity. So it is done for a period of 5 minutes. It will just accelerate the bleaching process. The next technique that we're going to see is inside-outside bleaching technique. So in this technique, both intracoronal as well as extracoronal bleaching is done. So it's mainly for patients who want rapid results, very fast results, not used commonly. But we look into what are the steps in this procedure as well. Preoperatively, we have to assess the endodontic status of the tooth, reopen the access cavity, ensure the chamber is free of gutta percha, seal off the root filling with resin modified GIC or any barrier, place the gel into the tooth tray and insert it into the mouth, remove the excess and place it in position for at least 2 to 3 hours or preferably overnight. What are the advantages in this inside-outside tooth bleaching technique? Is that there's more surface area for the bleach to penetrate. Treatment time is in days rather than weeks. It will decrease the incidence of cervical resorption and use lower concentrations of bleaching agent. Disadvantages in non-compliant patients, it might result in over-bleaching, that the teeth might become very white, and also sometimes cervical resorption can happen. So this is a case where inside-outside tooth bleaching is done. So this is the tray that has to be fabricated, where only in this one tooth we're going to be placing the bleaching agent, both intracoronally as well as extracoronally onto the tray also. Another case report where the tooth has undergone inside-outside tooth bleaching technique. We can see here the gutta percha white cement barrier placed into the coronal part of the tooth and also onto the tray and post-operative picture. So what are the complications and adverse effects of this technique? Is that first and most important is external root resorption or cervical root resorption. So when does this happen? Is that usually after placing a non-vital or intracoronal tooth bleaching, we tell the patient to come back after 2 weeks. In some cases, the patient is extremely happy with the result and doesn't come back to the dentist, and the bleaching agent is still left in place. In those cases, mostly we can see that there is this kind of cervical resorption that happens in the root. Some other adverse effects are chemical burns, damage to restoration, tooth sensitivity, but which is very in a minimal percentage only. So one risk is that immediately after tooth bleaching, we can't do composite restoration because the bond strength of the tooth is reduced. So some articles say that we have to wait about 2 weeks, some say about 3 weeks. So it's better to wait for 2 to 3 weeks and then go ahead for a composite restoration, because if the bond strength is lower, then the composite restoration might fail. In patients who are in a hurry, who can't wait for 2 to 3 weeks, we can use something called as a catalyze, that catalase, which will actually eliminate the residual peroxides from the access cavity. So what are the post-bleaching treatment? Now, commonly patients will tell that they have dentin hypersensitivity. For now, commercially available agents have made it sure that so much of sensitivity is not experienced by the patient, but yet because of if you're using heat or light, the patient might feel some amount of sensitivity after tooth bleaching because of the dehydration basically. So post-bleaching treatments would be to apply fluoride, sodium fluoride, which will increase the micro hardness of the enamel and also decrease the sensitivity for the patient. Potassium nitrate also, especially in light activated bleaching, it can help in reducing the sensitivity. Next is ACP, CPP, mostly given for pedo patients. This also can be used like amorphous calcium phosphate, casein phosphopeptide, commercially available as GC tooth mousse. So this will enhance the lustrous shine to the teeth. So some post-operative instructions that are given after teeth whitening, especially for the first 48 hours, is that avoid sugary, acidic, colored food, no smoking, drinking, or no colored beverages like Fanta or Coke, none of them should be taken for the first 48 hours, especially. Second is to avoid food and beverages that are too cold or too hot, as your teeth will be sensitive for some time. Also, in order to make that better, we can ask the patient to go home and rinse their mouth with lukewarm water, which will help in reducing the sensitivity. The next instruction is avoid colored dental hygiene products, including toothpaste or mouthwash. Green color mouthwashes, red color toothpaste, all of them should be avoided. Maintain daily oral cleaning routine that includes brushing and flossing. And also, some people say that teeth whitening touch-up should be done every 12 months. But in 2024, there's been a review article which is published, and they say that mostly bleaching lasts its results up to 3 to 4 years without changing the shade, after which it might slightly change. The other instructions are that if there is an area in your gums or gingiva that is sensitive, do not brush that area or do not touch that area for some time, and only do warm saline rinse. So long-term results will vary, and this can depend on the original shade of your teeth and include habits such as smoking, drinking, colored beverages like coffee, tea, red wine. And existing fillings and crowns will not whiten with the bleaching technique, which is very, very important to tell the patient. Therefore, they have to change these crowns or fillings in order to match your new smile shade. So have you heard of a term called as bleachorexia? So these are patients who have an addictive behavior towards tooth bleaching. So they will have overuse of in-office and at-home bleaching products. And those who are in a never-ending quest for a brighter smile, they will always want their teeth to look whiter. So in those cases, we just have to educate the patient and tell them this is the original tooth color and only some amount of tooth lightening can happen. Let's look into a case scenario. This is a patient who has mild yellowish discoloration in his 1-1 and has reported to a dentist post-trauma, but is completely asymptomatic. And the patient wants to fix the tooth color. So in the radiograph, what we see is that there's completely calcified root canal and not much of periapical changes or anything. And patient is asymptomatic also. So in such a case, what do you think that which would be vital or non-vital tooth bleaching would be right way to do it? So in such a case, what we have to do is that first try extracoronal bleaching. That is vital technique because the patient is not symptomatic in any way and there are no periapical changes also. In case it lightens up with the vital bleaching of that tooth alone, then there is no need to do root canal or attempt root canal and do intracoronal bleaching technique. So with this, I would like to summarize my presentation. So first thing in tooth bleaching is diagnosis and treatment planning. So in order to have good treatment planning and effective diagnosis, we have to ask a detailed case history of the patient. What caused the discoloration? What are the habits of the patient? What is the patient expecting out of this treatment? Next is treatment, whether it should be non-vital or vital tooth bleaching, which will be a part of treatment planning based on their clinical and radiographic examination and also the etiology. Then is to select at home or in office and suitable material for both at home and in office bleaching technique. And most importantly, post-treatment management, give them instructions and also fluoride, which will reduce the sensitivity if the patient is feeling sensitive. I would like to conclude this presentation. If there are any doubts, you can reach out to my Instagram profile and directly message me. And this is a picture of my department staff, seniors, juniors from GDC Trivandrum. So I had to include them somewhere because my post-graduation days are really special. And this is my first lecture about tooth bleaching. Thank you.
Thank you, doctor. Thank you very much for this informative session. So, as we are moving towards the end of the session, we'll have a small question answer part where the participants could ask the questions in the chat box. And some of the questions are already put up. I would like to read it out for you, doctor.
Sure.
And one of the question is that what is the commonly used protective barrier in intracoronal bleaching?
Okay, the commonly used protective barrier for intracorneal breaching is resin-modified glass ionomer cement, which is light cured. Prevest has a very good resin-modified glass ionomer cement. It comes in a syringe that can be dispensed intracoronally. It will just go into the right place, and then we just have to light cure it.
Thank you, doctor. And the other question is it necessary to do polishing even after bleaching? And one more question is that can we mix two different bleaching brands at the same time?
Polishing before bleaching is definitely necessary because after scaling, there might be certain cracks and irregularities on the enamel. So in order to avoid any hypersensitivity, we would say polishing before bleaching is very essential. After bleaching, it depends, not maybe immediately, but later, if the patient wants that lustrous shine to come out, then yeah, you have to polish the patient's teeth. And about the other question, where mixing two different bleaching agents, I've not tried it, honestly, and I've not seen anyone do it also, so I'm not aware of that. I maybe will look into it and come back.
Thank you, doctor. Another question is when to remove the internal bleaching agent and the barrier too.
So the barrier doesn't actually have to be removed because it is resin modified GIC. So it will stay in that place only. Some of the bleaching, like I told you, each bleaching agent has a manual where it is written that for this amount of time you have to use. So now in this video, I had shown opalescent endo. So for that, they say like about 7 days. There are some agents that can be used for 2 weeks. Now, after 2 weeks or 7 days, we recall the patient and then we check how is the bleach, how good is the bleaching that has happened on the teeth. And if the patient is actually happy with the shade, then we can remove the bleaching agent, clean it nicely with saline, and then put a temporary, and then after 2 weeks go for a composite restoration. If the patient is not happy and if we want to repeat the procedure, we have to remove the bleaching agent and place a new bleaching agent after 2 weeks.
Thank you, doctor. And one more question is fluoride application. When should we do the fluoride application? On the same day or they need to wait?
They need to wait. Better to wait, at least like we can recall the patient after 2 days and check how it is. For those 2 days, we can tell them not to have anything too hot, too cold. And later, we can after recall the patient after 2 days for a review and then do the fluoride application only if it's necessary.
What are the effects if the marginal gingiva is affected by bleaching?
Okay. Usually, if the marginal gingiva is, we have to protect it because basically what materials we're using are hydrogen peroxide, carbamide peroxide, sodium perborate. So if these go onto the soft tissue, what happens is that they will create some white spots on the gingiva or on the lips, which will actually be very unesthetic for the patients. The patient has come for an aesthetic treatment. We don't want them to look unesthetic in any way, right? So what will happen is that one white spot will be seen when the material seeps and it will reach the gingiva. So it is very, very important to protect all of the soft tissues. If you're able to use rubber dam, well and good. If not, then cheek retractors and all cotton rolls and petroleum jelly Petroleum jelly actually prevents, even if there's some splatter, it'll actually prevent that, damage to the gingiva and the lips and everything.
Thank you, doctor. One question is for chair side whitening, what is the percentage and how many days we need to bleach for the vital tooth?
In traditionally used bleaching agents, it was like around 30%. But now we don't have to worry about the percentage itself because products are commercially available. We just have to, buy that product and use it. What was the second part of the question?
The second part of the question is after how many times we need to bleach for the vital tooth? Like, what is the time gap for bleaching the vital tooth?
So in one sitting itself, we can do 3 to 4 times, depending on the manufacturer's instructions. So if it is Polar Office that I've used for my cases, so in one sitting, that is once the patient came, and each time I'm applying the bleaching agent, I'm leaving the agent onto the tooth for 8 minutes. So after 8 minutes, I clean, show the patient wants more tooth bleaching, or even I feel that better bleaching can happen, then I go for another round of bleaching. Like this, up to 4 times it can happen. That is, all this 4 times will get over in about an hour. Then we leave a gap for about 1 or 2 weeks and then recall the patient and try again.
Thank you, doctor. What is the brand for bleaching agent to be used in office?
I had mentioned the brands. Okay, this is not any sponsored lecture, but yeah, I have mentioned some commercially available brands like Opalison's Boost and Polar Office, which are commonly used. But there are many, many commercially available bleaching products in the market right now.
One of the question is how can we reverse if it is over bleached?
Uh, if it is over bleached, mostly we can't reverse it, but with time, that will come back to normal. Like it will take some time. So, which is why we have to recall the patient and we have to tell them that don't, if it is a in-office technique, that can be controlled because we are showing after every step, we are showing the patient. So, if the patient is happy, we stop at that. Secondly, if it is like a non-vital tooth where, like overzealous bleaching has happened, in those cases, we just ask the patient to wait. Some patients, it will revert back. And if it is like a patient is over motivated, then that is like than the prescribed amount of time. If the patient is using the bleaching agent for longer, then that is completely dependent on the patient's compliance. For 1 to 2 days after vital bleaching, also, the teeth might look a little extra white. That's because of the dehydration that has occurred to the teeth. But after 2 to 3 days, they get better because the hydration is reverted back after saliva and everything. So the hydration is reverted back, then the shade will start looking normal and it'll look better after 2 to 3 days.
Thank you, doctor. What material is the choice for cervical barrier in non-vital case?
Cervical barrier in non-vital cases. Yeah, like the first question I had mentioned, it is resin modified glass ionomer cement. GICs is what we usually place because it bonds to the tooth also, and it is a good barrier material, resin modified glass ionomer cement.
In cases of non-vital bleaching, how many sittings can we repeat till we get the desired results?
Non-vital bleaching is actually a very effective method. So most patients will feel way better just after one sitting. That is after 2 weeks itself, when they come back, they will see that the color changes happened. But I don't know how many times it can go up to, but usually I've seen clinicians do it for 2 to 3 times, not more than that.
What is a particular step if only focal or a localized area of staining is present?
I couldn't hear you, sorry.
Okay. Any particular step if only focal or localized area of staining is present?
Localized area of staining is present.
Yes, doctor.
Okay. So it again depends on the examination. What kind of stain is it? So if it is like removed after oral prophylaxis, uh, staining usually goes for oral prophylaxis. And if it is a structural defect, then like defect in the enamel, like a white spot, brown spot, such a tooth, we have to go for techniques called as microabrasion. Or if it is only like one tooth discoloration that we have to correct, then like I showed in that inside outside bleaching technique, no, the tray can be fabricated only for that tooth.
Thank you, doctor. One question is, does tooth get brittle with bleaching?
No, it does not get brittle. It is dehydrated but not brittle. Even the dehydration is actually reversible.
How long does at home bleaching strips, H2O2 strips bleaching last? Hydrogen peroxide strip bleaching lasts for how many days or
Strips are
how
not
long?
at all recommended for bleaching. It's just a part that I have included in the presentation. Usually, we do not recommend hydrogen peroxide strips. Main reason is that it can damage the gingiva when it is used by the patient. So these strips will be available in the market and the patient will buy them and use them on their own. So we cannot control the damage that is caused to the gingiva, especially marginal gingiva, gingivitis, abrasion, bleeding, all of that can happen. But coming to the duration, I think we have to follow the manufacturer's instructions based on each company because every company has its own time period, concentration difference. So it's very essential to read the instructions and follow them correctly.
Thank you, doctor. Can Boost and Polar Office be used without light cure?
Yes, it can be used without light cure.
Thank you, doctor. Thank you very much for this presentation. Let's conclude this session for the day.
Yeah.
Thank you for sharing your knowledge and expertise when it comes towards managing and as well as the procedure of tooth bleaching. Thank you, doctor.
Thank you so much for this opportunity. And I hope most of the clinicians who attended the lecture would definitely try tooth bleaching and also tag me on their posts.
Yeah, doctor. Surely many of us would leave this discussion with amazing takeaway points and would also implement techniques as per discussed. Thanks to all doctors for patient listening and your participation for this webinar. And I hope you all will depart the session with the positive and confidence. Once again, thank you, Dr. Shivani ma'am. It was a wonderful and informative session. We really appreciate your valuable time given to us for this series episode. And to know more about our upcoming webinars and workshops, please do check out our website, that is iatp.org, or simply follow our Instagram and Facebook pages as well. If you have missed our previous webinars, do check out the YouTube channel, as well as we really appreciate if you could subscribe as well. So thank you all and have a great night.
Thank you, doctor, for the wonderful section.